Now, I've actually heard some people say that since they were born, they've never enjoyed what it feels like to get a clear skin. They are always dealing with acne. Even when the acne goes, it comes up again. Like, they break out unnecessarily. Little things makes them break out. If you're in that category, then you probably have an acne prone skin. This is not a death sentence, so I'm sure that there are some people that having an acne prone skin has really affected their confidence. But I'm here to tell you that even if you have an acne prone skin, there are ways you can manage your acne prone skin. Just take it like you have diabetes or you have high blood pressure. There are ways you can manage your high blood pressure and your diabetes and still live a very long and healthy life. You need to be taking drugs consistently. You need to put your diet in check. Same thing applies to if you have an acne prone skin. You need to manage your acne prone skin, and trust me, once you manage your acne prone skin very well, you use the right skincare products, you maintain good and healthy lifestyle, trust me, you are not going to experience that much breakouts. Even if you break out, it will not be as often as you used to, and it will not be as bad as you used to. So proper management is the key. Now, if you don't believe that somebody can have an acne prone skin and still stay acne free, I am a living testimony. I have an oily and acne prone skin, and I'm here to tell you that I have been able to manage my acne prone skin and I rarely break out. And that is what I'm going to be sharing with you in this video, how you can manage your acne prone skin that will really help you stay clear from always breaking out. So if this sounds like something that interests you, you need to keep on watching this video to the end. And if you find it helpful, don't forget to hit the subscribe button to join this amazing, beautiful family. Trust me, you are not going to regret being here. If you have any questions, ask them in the comment section, and without further ado, let us just jump right into this video. Now, if you have an acne prone skin, there are ingredients you need to have in your skincare routine. If you have an acne prone skin and you are not using any of these ingredients, at least 2 of these ingredients in your routine, you haven't started. You are the reason why your skin is still breaking out. Same way that there are some drugs people with diabetes or people with high blood pressure needs to take to put those their sickness in check. This is the same way you need these ingredients. These ingredients are like your medication. The first ingredient is salicylic acid. Now, salicylic acid is one important ingredient for people with acne prone skin, especially if your acne is as a result of clogged pores. If you're always dealing with clogged pores, you are always going to break out. And if you don't have salicylic acid in your skincare routine, my dear, you haven't started. I call salicylic acid the vacuum cleaner. It goes into your pores, it dissolves the oils that might have clogged your pores. If you are not exfoliating your skin, dead skin cells can accumulate on your pores and clog them. That is why you need salicylic acid. Salicylic acid will help to dissolve the oils if it's oil that is clogging your pores. If it's dead skin cells that is clogging your pores, it will help to slug them off, because it is an exfoliant. Okay, it will help to slug those dead skin cells off. If it is germs or dirt that are clogging your pores, it will help to dissolve them and remove them and keep your pores clear. Once your pores are clear, there is nothing clogging them, you will notice that you will stop breaking out unnecessarily. So this is basically what salicylic acid does. It clears your pores and it exfoliates your skin. The next ingredient is benzoyl peroxide. If you're dealing with inflamed acne, if you have like all this cystic acne and you don't have benzoyl peroxide in your skincare routine, since you haven't started though, if your acne is as a result of bacteria, you need benzoyl peroxide. Benzoyl peroxide is one ingredient that will help to fight acne-causing bacteria. There is a bacteria that causes acne. Once your pores gets clogged, it gives room for the bacteria to enter into your skin, and once your pores get infected by that bacteria, you begin to experience inflamed acne. And one ingredient that will help to target or fight that bacteria and kill the bacteria is benzoyl peroxide. So in other words, if you are dealing with blackheads or you're dealing with whiteheads, the best ingredient for you is salicylic acid. If you're dealing with inflamed acne, like your acne has pores or cystic acne, the best ingredient for you is benzoyl peroxide. Another ingredient that you should have if you have an acne prone skin is azelaic acid. Now, azelaic acid has antibacterial properties, meaning that it can help to fight the bacteria causing acne, but it is not as effective or as strong as benzoyl peroxide. Okay, just note that, but it also works. Also has anti-inflammatory properties, and it will help with your post-inflammatory hyperpigmentation. So if you're dealing with acne and you're dealing with dark spots, azelaic acid is one ingredient that will help you to fight those two things. So while it is helping you with your acne skin and also helping to fight or fade your hyperpigmentation, your dark spots. Another ingredient that is going to help you for your acne is niacinamide, especially if if you have an oily skin. If you have an oily skin and you have an acne prone skin also, niacinamide should be in your routine. Like, it is a must. Excess oil production can go into your pores and clog them, so you need something that would help to manage oil production on your skin, and this is where niacinamide comes in. Niacinamide will help to control oil production. It will help to reduce the amount of oil that your skin produces, and once your skin reduces the oil production, you will notice that your pores will no longer get clogged. It will also help to improve your skin texture, and if you're dealing with dark spots, it will help to fade your dark spots. Another ingredient is retinoids. Retinoids like adipalene and tretinoin can actually really help people with acne prone skin. You can use these two ingredients, adipalene and tretinoin, for long-term management. Okay, these two ingredients will prevent your pores from getting clogged. Okay, if your skin cannot handle tretinoin, you might want to go for adipalene. Adipalene is milder, it is more gentle, and it can be tolerated by most skin types. Now, the main function of retinoids is to increase cell turnover. This is the reason why when you use tretinoin or you use even adipalene, you notice purging. The acne you see on the surface of your skin that we term purging are those acne that are inside your skin. What retinoids do is that they push it to the surface of your skin faster. So maybe if they would have taken 6 months to appear one by one on your skin, tretinoin or adipalene will push them faster into your skin. So once they appear faster on the surface of your skin, your treatment can now proceed from there. So this is how tretinoin works, and this is what I mean by increasing cell turnover. Now, the last ingredient that can help people with acne prone skin is zinc. Zinc has anti-inflammatory properties. It also helps to reduce oil production, and it has antibacterial properties, so it will help to kill bacteria causing acne. You can use some serums that contain zinc, or you can take zinc supplement, but this one should be prescribed to you by your doctor. Some zinc supplements that are very, very good for acne, especially hormonal acne. So now that we've known the ingredients that you need in your skincare routine that will help you to manage your acne, let us use these ingredients to create a skincare routine, a day skincare routine and a nighttime skincare routine that will help you to manage your acne properly. So in the morning, I always say this, your morning skincare routine should be about protecting your skin. So you're going to cleanse, you are going to use your antioxidant serum, and you're going to use your sunscreen. These are the important things you need. Any other thing you want to add up are just additional. If you want to add a toner, it is not compulsory, it is optional. If you want to add essence, all these things are optional, but the main important things you need in your routine, your morning skincare routine, your cleanser, your antioxidant serum, and your sunscreen. If you have an acne prone skin, you need to use a cleanser that contains active ingredients like salicylic acid or benzoyl peroxide, depending on the kind of acne you have. So if your own acne is blackheads and whiteheads, you need to use a salicylic acid cleanser. If yours is inflamed acne, cystic acne, you need to use a benzoyl peroxide face wash. So one tip I'm going to give you when you are using cleansers that contain these active ingredients is to let it sit on your skin. So after you just apply it on your face, allow it to stay on your skin, just so that the ingredients can go into your skin and work for you. Allow them stay in your skin for about 3 to 5 minutes before you rinse off, especially if you're using a salicylic acid cleanser. Then for your antioxidant serum, you can either use niacinamide, ferulic acid serum. Then the last one is your sunscreen. You need to use like a sunscreen that suits your skin type. If you have a dry skin, you can use like a moisturizing sunscreen that will not clog your pores though. The key thing there is to use a non-comedogenic sunscreen, a sunscreen that will not clog your pores. It could be hydrating, it could be moisturizing, but it should not clog your pores. So this is what your morning skincare routine should look like, and the products you need to look out for when getting any product for this category. If you want to use a moisturizer, you can get a moisturizer and use it in the morning. It depends on how you feel. Honestly speaking, I don't use moisturizers in the morning because I have an oily skin, so I always like to skip my moisturizers. But if you have a dry skin and you still need to use moisturizers, then you can get a moisturizer. Look out for ingredients like ceramide, hyaluronic acid, aloe vera, panthenol. All these ingredients are what you need. They are hydrating, they are barrier friendly, they are also going to help to nourish your skin. So these are ingredients you need to look out for when you want to get a moisturizer. Now, for your nighttime routine, there are two ingredients that I'm going to advise you use depending on your skin type. So if you have a dry skin, you are going to incorporate azelaic acid in your skincare routine to use it at night. If you have an oily skin, you're going to incorporate tretinoin in your routine. I'm not going to advise you to use tretinoin if you have a dry skin. Now, I've come to realize that people that experience side effects, like the downsides of tretinoin, are people that have dry skin. If you have an oily skin, trust me, there is a high percentage that your skin is going to love tretinoin. But if you have like a dry skin, you can manage it though. You can manage using tretinoin, but you will need to double on your hydration. But if you don't want to go through all those stress, please get azelaic acid. So after you cleanse, you use your tretinoin or your azelaic acid cream or gel, depending on your skin type, okay? And then you layer in with a very good moisturizer. You remember the cleanser I mentioned earlier contains active ingredients like benzoyl peroxide and salicylic acid. So this is how your routine will look like at night. You are going to use a gentle cleanser, and then you use your tretinoin, and then you layer in with your moisturizer. If you're going to be using tretinoin, start by using 0.025%. If your acne is very severe, you can increase as time goes. If you're using azelaic acid, after you cleanse, use your azelaic acid and then you moisturize. So this is a very effective skincare routine to help you manage your acne. Now, if you have an acne-prone skin, topical treatments are not just the only solution. You need to work on your diet, your lifestyle habits, and even your hygiene. Yes. The first one is to hydrate from within. And how do you hydrate from within? By drinking lots of water. Aim for 2 to 3 liters of water daily. It is super important and it is going to help you a lot. Limit your sugar intake. Limit processed food, limit your oil intake, like all these fried yam, fried plantain. You need to limit them. Instead of taking all this unhealthy food, take lots of fruits and vegetables. Take foods that are rich in omega-3. Take foods that are rich in zinc. Trust me, once you combine good lifestyle habits with a good skincare routine, just like the one that I talked about, you are going to see huge difference in your skin. It is what really helps me to manage my acne. As you can see, I rarely break out. Like, I can't even remember the last time I broke out, except this one witch here that I just saw this morning. I literally just saw this small thing here this morning, but I'm not bothered because it is nothing compared to how my skin used to look like. So with the right lifestyle and the right diets and the right skincare products and skincare routine, you can manage your acne prone skin. Now, if you're doing everything right, you are taking good food, you are maintaining proper hygiene, you are washing your beddings, you are eating right, you are using the right skincare routine, and you have not seen any changes in your skin, then you need to visit a doctor because it is probably hormonal acne. So guys, what do you think about today's video? Share with me your thoughts in the comment section. If you have any question whatsoever, please ask them in the comment section. Until I see you on my next one, guys, have a wonderful week. Bye.